levels. To achieve lasting change, we have to understand and confront the multiple intersecting factors at play. However, Dawes insightfully argues that we have to be mindful of more than the social determinants of health. More specifically, he indicates that the political determinants of health are actually far more influential and can be far more insidious when they are not properly addressed, given that the American political process is the foremost avenue for implementing change. He demonstrates that many challenges recognized as social determinants are in fact the result of political determinants. These political determinants are often masked as social determinants because it is more palatable to do so. I commend Dawes for not only creating a detailed framework that outlines the political determinants of health, but also providing us with timely enlightenment about the challenges we are facing. Once we clearly understand what the political determinants are and how they intersect with health policy, we will be much more prepared to effectively harness the political process to implement needed changes. America has a long history of tireless advocacy to create greater equity in society and in health. In recent years, we have seen signs of progress, such as the implementation of the Affordable Care Act, but we are also witnessing significant setbacks and inertia. There is increasing recognition of the need to address historical disparities, and phrases such as social determinants of health, health disparities, and health equity are losing their stigma. At the same time, evidence of persisting and sometimes widening disparities continues to accumulate. We cannot allow the rhetoric of addressing disparities to tempt us to rest on our laurels. Now is the time to address unfinished business with renewed vigor and to keep pressing forward toward further transformation of the health equity movement. Senator Robert F. Kennedy once said, "Each time a man stands up for an ideal or acts to improve the lot of others or strikes out against injustice, he sends forth a tiny ripple of hope. And crossing each other from a million different centers of energy and daring, those ripples build a current that can sweep down the mightiest walls of oppression and resistance." Mighty walls of oppression and resistance face us as Americans. The political determinants of health and their impact on achieving health equity have erected some of the more powerful, yet rarely recognized and discussed walls of resistance. The lessons in this book send out clear ripples of hope that can create new tools and momentum to improve health outcomes of untold millions of Americans and to reduce and ultimately eliminate inequities in health. The health equity movement is just that, a movement of people committed to advancing health equity for all communities. It requires the participation and unwavering commitment of all of us, working together to address all the determinants of health and advocating for improving the quality of life for those who have been historically ignored and excluded from opportunities afforded other privileged groups. With leaders like Daniel Dawes and his innovative approach to addressing structural inequities, I believe that the mighty walls of oppression and resistance that we currently face can be overcome, and that the fight for health equity can serve as a desperately needed critical inflection point to provide justice for all and elevate America to its rightful place among the world's leaders. David R. Williams, Florence Sprague Norman and Laura Smart Norman Professor of Public Health, Chair of the Department of Social and Behavioral Sciences, Harvard T.H. Chan School of Public Health. Professor of African and African American Studies and Sociology, Harvard University. 1. The Allegory of the Orchard, the Political Determinants of Health Inequities. The care of human life and happiness, and not their destruction, is the first and only legitimate object of good government. Thomas Jefferson, to the Republicans of Washington County, Maryland, 31 March, 1809. The movement to bolster health equity has heavily focused on health disparities, which are differences in health outcomes among population groups. However, not much attention has been given to understanding the factors, systems, or structures, laws, and policies that create, perpetuate